welcome to YourTown television program. I'm your host, Paula Joy MacNab. And as you who watch the program know that I have amazing, amazing guests. And I'm very privileged and honored to welcome Dr. James Ramseur. I will say, full disclosure, he is my personal physician, and I think very highly of him, his manner, his intelligence, his knowledge, and with that, I'm really embarrassing him. So I'm going to welcome him to the program. Dr. Ramseur, thank you for taking time out of your very busy schedule, catching those babies.
Indeed.
To be here. I didn't even know whether you would make it, because if you had babies coming, that's where you were going to be. So thank you.
Thank you for having me here, Paul. It's a real pleasure.
Yeah, well, we're delighted to hear what you have to say. And I'm going to jump right in because you are qualified beyond belief in your field. I don't even think we need to go into all of that. I want to talk about, well, I am going to ask you, what made you choose to become an OBGYN?
Wow.
I threw that one out. I didn't expect that one.
That's fine. I felt when I went into medicine, it truly was a calling.
Yeah.
And what I discovered as I went through med school was there are things that could be intellectually stimulating,
yes,
but not necessarily fulfilling for me.
Right.
I knew I needed to have something where I could be active, like surgery, but I also love the interpersonal relationship that you get from OBGYN. So doing everything from delivering babies to doing surgery to counseling for menopause, it covered the gamut. And at the risk of being less than humble, I always tell my classmates from high school and college who went into the clergy, you deal with people who bear their souls. My patients bear their bodies. Yeah. And then they bear their souls. Right. So my calling is equivalent or higher.
Wow.
So
that actually gives me shivers.
Well,
that's very.
I take it very seriously. I'm honored
and
privileged to be able to care for women.
Well, it's profound what you do, and you know there is a real level of trust, and particularly you know to be candid for a woman with a man.
Undoubtedly.
You know, and often I have people say, you know, I want a woman, you know, GYN, and
I understand.
And I understand that too, and the beauty of it is that you do establish the trust because you have what? How many sisters?
I have one sister.
One sister,
right.
But mother, auntie,
right.
on and on and
exactly.
on. And you get women.
As you've heard me say, I had a mother, I have a sister, I have a wife, and I have a daughter.
There
I
you
get
go.
it. I get it.
He gets us, ladies. He gets us. Trust me. So you can feel very comfortable with this man. Let's talk about some general good health habits.
Yes.
Yeah.
Basically, it can be summarized in a few recommendations: sleep, activity, and diet.
Right.
This is well known. 7 to 8 hours of sleep a night.
Right.
Try to be uninterrupted.
Right.
Turn off the TV. Get into bed. Put down the book.
Right.
Get some real rest.
Right.
Activity, especially focus on exercise.
Right.
People ask me all the time, well, how much do I need? Recommendation is about 20 to 30 minutes a day. And it is advisable to break a sweat intermittently. So if you walk versus run, you need to spend twice the time walking to get the cardiovascular benefit as running. So it's okay to power walk. It's great to do anything.
Right.
And I also suggest that if you're going to sacrifice sleep versus exercise, I think it's a good idea personally to shave off 30 minutes to an hour and get the exercise in, because it's just beneficial. You feel better, your brain will function better.
Right.
And diet, many of these topics we could talk about for hours, but it needs to be balanced. You're trying to watch out for cholesterol, sugar, and salt.
Right.
So of course you want green vegetables and colored vegetables for antioxidants. You can, if you don't want to do meats and that type of things, that's great. You can compensate for proteins elsewhere.
Right.
I like to keep it simple and sweet and short and sweet. So I say, basically, plants use chlorophyll, animals use cholesterol. If you're worried about your cholesterol, if you never eat animal products, you'll never consume cholesterol.
Oh, perfect.
So all the other stuff is high-tech or however involved you want to get, that's okay, but that's basically what you want to try to do.
So what about, just to go back to the sleep question, because I think that's very, very important. I know it is for myself personally, too much information. But, you know, for those of us whose brains are just going crazy in the night, what what do you say to us? What can help us through that 2 a.m. wake up when we're going, okay, where's everybody?
That is clearly the most vexing and challenging situation we deal with. That 2 a.m. to 3 a.m. wake up can be so detrimental. The best advice is to change your station. Get up. Don't try to count sheep laying in bed thinking you're going to fool your brain. You're probably overstimulated. You're managing your next 18 hours instead of the next 4 hours, right? No one lays in bed and thinks of nothing.
He's been watching.
Right. So change your venue. Do a little walking, not heavy exercise. Just get up and move around. Warm milk has tryptophan. That's a known amino acid that helps you relax. So maybe even do one simple task to take that off the checklist. I find when I'm stressed and I have 20 things to do, if I just take one off, I can breathe a little bit better because I've already accomplished something for the day.
That's really true. And one tip that I'll share, if I may, years ago, one of my assistants bought me a little lighted notebook. And what helped me so much was just rolling over, writing down that whatever blah, 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 blah was in the brain.
It's brilliant.
And going back to sleep. And that personally really helped me because that's the chatter that gets me going.
It's always about your brain.
It's always about the brain.
The other two things that are critical are avoid tobacco smoke, and that means firsthand and secondhand. Do your body a favor. Be mindful of the alcohol and drugs that you may be taking, and that's both medicinal, pharmaceuticals, as well as recreational if you go that route. And, feed your brain. Feed your brain. Do things to stimulate your brain, whether it's a crossword, Sudoku, something you like to do, but that actually requires some thought process. And to me, putting it all together, nurture your social and personal emotional health. Relationships are so critical.
Oh my gosh.
And you shouldn't take anything for granted. Just because they're related to you doesn't mean they have to like you.
They'll
always love you, but come on.
But sometimes they may not even love you so much.
It shows sometimes, exactly.
That's true. And the other thing too, just on this last sleep topic is, do you really need to watch the 10 or 11 o'clock news? Short answer, I don't think so.
I find that many people like myself have windows of opportunity. If you push through that window, you're going to be awake for hours after that. So give in, give up, get some rest, and make it work.
I like it. So how does a woman maximize her routine checkup? How can we best prepare for that?
I think the most important thing is to do a little bit of preparation. Recognize that this is your time with your physician. So be prepared. Have your questions in mind when you walk in. We're going to ask certain questions regardless.
That's right.
But if we know where you want to go, we can help you get there. And if it's going to be talking about your cycle or lack of cycle thereof, be specific. Think about what you're trying to gain out of this. I often say, as a bad analogy, you should spend at least as much time preparing for your physician visit as you do when you separate your wash for laundry. And think about when you take something to the cleaners. You know exactly what stain it was, where it is, and how long it's been there. Shouldn't you know that about your health concern?
Great analogy.
I mean, people walk in sometimes and it's just a void, and it's not a data dump. We can't sort through all the information. And possibly the most challenging thing we deal with is people's complaints of pain. If you really think about it, it's 100% subjective.
Sure it is.
We can't gauge it. We don't know, are you histrionic? Are you stoic? Are you just anxious about it? Is it really debilitating? Is it destroying your day? We want to help, but we can't if we can't get some kind of context to help. So know when it started, what worsens it, what aggravates it, what alleviates it. Is there anything that can mitigate the pain? Do you take analgesics? Do they work? And so much of that is so critical for the diagnostic aspect of helping people through pain. And it's not a given. And then one of my favorites is don't assume. I've had patients say, well, I told the other doctor that. How does that help me? I mean, we're not related.
You don't read each other's minds.
Exactly. It's like, well, when did you, it's like, then we get off on a tangential. Keep it focused. Remember who you're talking to, and let us help you.
Great advice. Great advice. And what about breast health recommendations?
Yes, one of my favorite subjects. There's an entity called the United States Preventative Health Task Force. It's been around since 1984-85. Their charge is to look at every diagnostic test that's done in the country and use the denominator of does it save lives. So they look at everything from mammograms, PSAs, cholesterol screening and the like. So the first thing I tell patients is be your own advocate. Do a breast self-exam, and that consists of a couple of components: visual inspection, palpation, expression, try to elicit some discharge from the breast, and then report it to your caregiver. It's okay to be afraid. It's okay to be intimidated. The challenge I have with the USPSTF is they say don't recommend breast self-exams because it makes people anxious. We'd use unnecessary tests, and we're spending too much money on diagnoses that don't end up going anywhere. That's difficult. That's really not palatable when you recognize that 70% of all breast cancer is discovered by the individual touching their own breast. How do I deny that and say it's better for the government to save money than for you to protect yourself? It's not going to happen with me.
It's not, thank goodness, I will say.
And then mammograms. There's a lot of negative information because it's radiation. Well, it's 0 mammograms, so it's been reduced. Important thing to recognize is that after the age of 35, the female breast becomes more resistant to radiation. So no one does a routine mammogram until at least 40. If I had my preference, we'd all do a baseline at 35 and then go to 40, just because you have something to compare it to. But that's not cost effective. And the reason we do the mammograms, to dispel any myths or suspicions, it's estimated that by the time you can palpate or feel a breast tumor, it's been there for 7 years.
7 years?
7 years. Think about the opportunity you have to detect that before it becomes problematic. What does that mean?
No idea.
If the tumor is less than 3 centimeters, the width of my 2 fingers, it's often a simple lumpectomy. Not even radiation, not even chemo. So if we catch it early, we treat it early, and everybody's happier. But the government will say, because it's cost effective, people are not dying of breast cancer. Well, that's a great thing, but it doesn't mean you can't avoid mastectomies and chemo and radiation.
Which are terribly
quality
costly
of life and
to the system.
Life-changing. Exactly.
Life-changing.
Exactly. So you have to consider yourself the important variable here. Your doctor will support that, and we talk to you individually. The most important thing is have the individual conversation, because the guidelines say specifically based on the both of your concerns and findings. Then you can go outside the algorithm.
And it's so powerful what you're saying here, because we get this information in the news, or we get a study, again, the soundbite news, which, as you can tell, is one of my hot buttons. I don't like it. I like journalism. And people get scared, and people make poor decisions. And so this is why this is great. Let's talk about transitioning into menopause.
Yes. So menopause is technically the cessation of menstrual flow. It occurs on average between the age of 40 and 55, and the average age is 51.4 years. It's a transition. It's not the end. And what I try to encourage people to do is look at their lives as a continuum. And recognize that there was a period of time before you were exposed to estrogen in large volumes. There's a period of about 40 years when you're bathed in estrogen, and then you're going to have to adjust to the loss of the estrogen. And it's a loss to your brain. Your brain loves estrogen. There's no question about it. This is true. The effects that can occur when you have this significant decrease in estrogen, and I hesitate to look at lists, but there's 30 different things. It entails mood swings, changes in cognition and memory, agitation, sleep disturbances, hot flashes, night sweats, physical discomfort with intercourse, vaginal dryness, burning, and the like. So it's myriad symptoms, but all the symptoms don't absolutely require hormone therapy. That's always an option. And factually, the only one-stop shopping agent that addresses all of the issues as much as possible is estrogen. So you have to deal with that. The studies don't support any benefit in terms of cognition and memory. But other than that, many of those symptoms are direct results of the loss of significant amounts of estrogen that your brain needs. So there are things you can do. Phytoestrogens are vegetables that make the brain calm down. The two big ones are soy, like tofu, and or soy milk when you cook, and yams. Okay, so that has a beneficial. Does nothing for vaginal dryness or painful intercourse. There's options of complementary and alternative medicine. A lot of people do acupressure, acupuncture, even exercise. So many women tell me, when I get going and I just feel so much better. I feel like a whole person. Lifestyle modification, again, the aforementioned tobacco, alcohol. You have to be careful. You're kind of beating your body up a little bit. There are some attributes, but let's be serious. There are neuroactive drugs, some drugs that are used for depression and other causes actually work to help with hot flashes and sweats. And then, of course, the aforementioned hormone replacement therapy. Recognizing that if you have a uterus, your doctor is going to work with you to have you specify by priority what your highest order of concerns are, and then address it with the safest agents or agents. Because the black box warning, like you see on tobacco, is very clear on tobacco products. Use hormones at the lowest tolerable dose for the shortest possible duration to transition through menopause. It's not to be used to minimize or avoid or manage chronic illnesses, even though it's been shown effective for osteoporosis, prevent colorectal cancer. We're not technically supposed to use it for that, and that's challenging.
If a woman goes off hormones or goes through menopause and goes off or doesn't start any hormones, can she start later on?
Yes, that you might find resistance in the medical community because technically, if you look at that warning, you've already well, depending on which circumstance you're talking about, that scenario, if you're 65 and you've already transitioned through menopause, most people are going to go, well, the worst is over. But that's sort of denying your need, isn't it? So a lot of times, if it's specifically vaginal dryness, atrophy, what we call, so many of the symptoms can be vasomotor, flushes and sweats, versus vulvar atrophy. Some poor women, just dabbing themselves with toilet tissue after urinating is painful. At that point, you need to be conscientious and compassionate. You can use topical estrogens that remain localized on the vulva and the vagina. You can use low-dose oral therapies. I think you have to individualize the circumstance. And what taught me that was when I dealt with my myriad breast cancer patients. So many couples come in and say, look, I've dealt with cancer. I'm not afraid of that. I know what that's like. I know what to do. I want a full and lasting relationship with my supportive spouse. What can I do? And the data is very encouraging in that regard.
Oh, that's really interesting. And we just have another minute or so, but you know, and we've touched on it a little bit. Some of the intimacy in later life. Can you just expand for just a moment on that?
Yes, I think we forget that the greatest erogenous zone is between our ears. And once we address the physical discomforts of our existence, making sure that we make sure we remember we have physical, mental, spiritual, emotional needs. It's a four-legged stool. We have to address all of that. And not to deprive ourselves of the warmth and love of our individual partner. You start out as two. Hopefully, no matter what happens in between, you end up as two. Talk to each other, make physical contact. It's amazing how many people respond to hand-holding, a stroke on the neck, a hug, you know, cuddle, spoon, whatever you need to do. But explain to each other what is the impediment, what is the challenge, what's the fear, what's the anxiety.
Yes, of course.
Our parents have input, society, the internet. There's so many things that play a factor in our mental existence, and we don't realize what a role it plays on us as human beings.
It really does. And you know, you've touched on so many important points, and I'm just, again, I thank you so much for your time. You've enlightened and educated, and it's just a treat. And I highly, highly appreciate you and your candor and in your forthcomingness, if there's such a word. And thank you for being with us today.
Thank you. You're most gracious. It's been my pleasure.
It's been great. I'm your host, Paula Joy MacNab. You've been watching YourTown television program. Join us again.